Lovely to meet everyone online. Thanks for joining us, and I'm glad you could find some time in your very busy schedule to come and find out about the fantastic story of Eolas Medical and the work we've been doing with Declan and his team. As far as quick introduction, I'll introduce myself, then I'll ask Declan to maybe introduce himself very quickly. I'm not going to spend too much time really going into the depths of LandingAI and our fantastic products around agentic data extraction. But what I will do is provide a quick, just a quick introduction to what are we talking about today from a technology perspective. And then I think the real focus of today will really be the story that Declan can share with us on kind of how he's taken that technology and actually, deployed it in his business and how he's doing some fantastic work. And I think at the end we can do some quick questions and answers if everything works well. So that should be fine. So as far as myself, like Ray says, I'm not going to spend too much time, but my name is Tian Razandich. I'm based out of London, and I'm the general manager for LandingAI, really focusing on supporting our key customers and partners establish themselves in our region and also get the best value from what our technology does. Declan, how about yourself?
Perfect. Thanks very much, Tian, and thanks everyone for joining as well. Great to be here and chat about what we're building using LandingAI. Very quickly, as a bit of background, so I'm a medical doctor myself. Worked clinically in the NHS for about 5 years. I'm also a software engineer as well, and that's what really led me down to founding Eolas. So yeah, great to be here. Happy to jump in and talk about what we've built.
Fantastic. I think we've gone through the agenda, but in a nutshell, I think it's as I mentioned, is really just talk about introduction to the principles around agentic document extraction, focus on the case study, but then also look at the key results and use case that Declan has created, and then, like I said, Q&A at the end. So I think first and foremost, I think it's always good to kind of, put some foundation in place around LandingAI and who we are as a company. Some people on the call may not even know who Landing is or may have some ideas of the company. We're a very interesting company, I always say. And I think the foundation of the business and kind of our kind of, focus in the market and our pedigree as a company kind of focuses on our founder, Andrew Ng. Some of you may know him. He's a very well-known thought leader, as well as visionary in the world of AI, and has been doing that for many years. So some of the really interesting aspects of where AI started years ago in some principles around the Google Brain Initiative. He was the founder of that, as well as he has founded many companies over the course of the last few years, LandingAI being one of them. As a company, we've been around for about 4 or 5 years. We're based in California, Palo Alto, and we've got a really close, very tight-knit team, really highly technical team focused on really everything to do with kind of unstructured data, visual AI, and really getting value from that part of a company's data. From that side, we actually have two main platforms, which one of them we're going to speak about today, but just to give you some context as to what we also provide. We've been providing a visual inspection product for the last 4 years, which has been very successful, really helping companies identify, defects within a production, or whether it be a manufacturing process, or really any visual process where you need to identify, issues that may exist in a particular visual piece of data, unstructured data. And today we're going to be speaking about our latest product, which is our document understanding product, or our agentic document extraction product, which is really exciting. It's one of our newest products, and it has been, I'd say, a massive hit within the market. We are inundated with requests, and it's really a really exciting product, and one that we see really just growing and growing within our customer base, which is quite exciting. So let's move on a little bit as an introduction to the product itself. So I think first and foremost, we all know in our various companies and the work that we do that, one of the center pieces of, our daily lives is documents. And documents have been there for, many, many years within our corporate environment across all industries. So, whether it be healthcare, whether it be financials, banking, etc., there is no end to the amount of documents. And what you're seeing today is that companies, the next level of ingestion of data for a lot of the big AI projects that have been done is focusing now on actual documents. And documents now are kind of representing a huge challenge to companies. Some of the challenges people are seeing is the fact that they are complex. They're not all written in the same way. a lot of them are written with a very interesting format, sometimes, based on potentially how a reader or a viewer may see the document, or how the author thinks the document should be consumed. But often it's not very logical to a system that may be looking at it in order to kind of extract the information. In addition to that, as you know, there's a lot of visual representations in documents. It may be graphs, it may be tables, it may be images. And sometimes those are, again, very difficult to understand, often not having the correct markings on them, and often being quite difficult, for traditional, methods of extraction to really deal with. We all know that things like OCR has been around for many years, and has done a great job in what it does. And if you have simple documents, that can actually do a fantastic job of extracting information and allowing you to drive a particular use case. Where things get quite limited is, like I said, when you start dealing with this high complexity. And what companies are starting to see is attempts at managing or trying to ingest these types of complex documents are leading to a lot of challenges. And that is everything from, just dealing with the speed of ingestion, because there is a lot of horsepower required to do that. There's a lack of the ability to really kind of pin down where information, once it's been extracted, where it comes from, which is pretty important, especially in worlds where, like financial services, where, as you know, the ability to have an audit trail back to a particular piece of data is vital. So from that perspective, that traceability is fundamental, and there is a lack of that does exist, as well as often existing attempts or existing technologies that are trying to extract information can do a reasonably good job sometimes, and sometimes it doesn't. So having that scenario where 80 or 70 or 60% of your documents are being extracted, some of them with inconsistencies, and the accuracy isn't there. Sometimes that big gap in the ability to actually extract actually lands up where companies have to just put in people again, which is a huge a cost issue, as well as really a negative when you're trying to move forward with the project and drive automation, and you land up having to kind of backfill with people in order to get the levels of accuracy that you need. So I think a lot of us around this call will be aware of these types of challenges, and I'm sure you've seen these types of documents that existed within your domain. So we'll talk about some of them, and I'm sure Declan will give you some great examples of the types of documents that we will be dealing with. So in a nutshell, again, I wanted to keep it quite simple as far as kind of how we manage this, but LandingAI, and I think this talks to, again, where we come from as a company. Because of our really kind of deep tech background, and our focused within the world of visual AI, we've kind of looked at this challenge in a very different way. We've got some of the best engineers in the world, I believe, some of my best colleagues, and they've been kind of attracted by working with Andrew. And we have the scenario where we built a technology that really looks at things in a slightly different way. So first and foremost, when we look at a document, we actually understand it as an image. So we understand, what's the layout of that document, what are the different components within it, how would naturally a person read that document. And once we've actually done that process, we use our kind of proprietary foundation models that are kind of extracting that information, which is part of our kind of secret sauce to what we do. And then we extract that information, the layout, and we understand that layout and kind of weave it together. So we're not just getting blocks of information, but we're also understanding the interconnection and the actual interdependencies in how the information is laid out and how they relate to each other. So it's a very important process in that way. In addition to that, we also have the ability to then visually ground that information. So once we've extracted it, we can actually then allow you to then actually link back and actually see exactly where in that document that information came from. And within the JSON, we provide both markup and JSON, and you've got the ability to then pinpoint exactly on the page where that information comes from. So that's vital in use cases where companies need that audit trail back to where that information comes from, and then the ability to then query it in the right way. So that's really important. But it's not just the linking back, but it's also understanding, very complex tables and really charts and graphs and all of that type of visual data that exists within a document. And as you know, most documents are not very simple, as I've mentioned already. And that ability for us to do that, we've got that ability to kind of understand that and really visually extract that information and then to use it in a very effective way. Again, images is key, and we also allow you to then, get a lot of that intelligence out in a very, comprehensive way. So, in a nutshell, that's effectively our platform. I would welcome everyone on the call to go to our website. At the end of the call, you'll actually see a link to a kind of show playground that you can go into. You can even upload some of your own personal documents and actually see the power and how proficient the system is on actually extracting information in a highly, highly accurate way. So that's really exciting from my side. Anyway, so enough about LandingAI. We'd love to hear about Declan's story. So I'm going to hand over to you, Declan. I'd love to, if you can give us some context to your company and really kind of, where did you start with your challenges that you started with?
Yeah, perfect, Tian. Thanks very much. Yeah, so as I mentioned at the start, so background as a medical doctor, we found myself and my colleagues, we found that when we were trying to access knowledge or information, specifically our own institution's information, it was very, very difficult. Usually that is stored away on, SharePoint or an intranet system. There's hundreds of, or maybe thousands of different types of documents, and they all are, 40, 50, 60 pages long with lots of different diagrams. You have to know that that document exists. You have to know where it is, etc. So we found it was very hard to find the information that we wanted to when we were treating patients. So we developed a solution for our own hospital and we launched it. And within about 6 months, it was live then in 28 hospitals. So including Stanford and a number of other hospitals around the world. So we really at that point, we realized, right, this is a fairly ubiquitous problem. Um, and then we did a bit of research into that, and we found that over 2 billion medical decisions are made every single day across the world. So, there's 50 million healthcare professionals on the planet. They make decisions, 23,000 medical decisions every single second are happening. And a lot of the time, these decisions need to be informed by the information that's on those documents, essentially, or in that content. If we can just go to the next slide as well. Perfect. And then the next one as well, if that's okay. Brilliant. So the downstream effect of this are quite significant as well. So as you can imagine, this it costs a lot of time. So the average healthcare organization spends over 6,000 hours of its teams just searching for these clinical guidelines, policies, procedures, etc. All of those documents that are locked away. So you have all of this rich medical knowledge that's locked away. As a rough estimate, it's about $2 million spent per healthcare organization every single year just searching for this information. And if we go to the next slide as well, I think I've highlighted here that globally this represents about $100 billion of spend of healthcare professionals just searching for the knowledge that they need. And if we move on as well to the next slide. So the two biggest downstream effects of this are inefficiencies in patient care and reduced compliance then with the best practice. So because this is significantly time consuming to try to find that information that you need, it results in less patients seen, higher cost of care delivery, and then increased staff burnout as well. It's extremely frustrating as a clinician when you know you need to access information to double check something or to see what the protocol is for a certain condition, and you're going through an intranet to try to find it and you just can't find it. So that actually contributes to staff burnout as well. The other aspect is it reduced compliance with the best practice if you're not able to access that knowledge, and that increases medical errors, increases patient morbidity and mortality, compromises outcomes, and then ultimately it can cause increased litigation for the health system as well as a whole. So what we've built at Eolas then is this AI powered knowledge management platform. So a hospital at a very high level will upload all of their content to the platform. We intelligently index the entire corpus of their knowledge using LandingAI and using computer vision to extract all of that. And then we build a full RAG search pipeline off the data that comes from that as well. We also combine their institutional or internal knowledge with external medical knowledge as well. So national level best practice and latest evidence as well. So I think in the next video or in the next slide, there's a video over very quickly as well, just a bit of background about how Eolas is being used. So it's been used by over 500 sites across the world. We launched it about 3 years ago. It's been used in over 80% of all acute hospitals in the NHS. And then there's about 30,000 users across the US in places like Stanford, Mass General, Boston Children's, and a number of others. And I think, sorry, yeah, the next slide is a very quick a growth chart of the number of users that are actually using it. So it's been queried millions of times per month. And really this is important to highlight this because The level of use this currently has and the growth rate that this is on, it's extremely important that the foundations that it's built on are sound and they're safe, and that the knowledge that we're extracting has been extracted with high fidelity. And that's really where LandingAI has come in and really helped us. So we can go to the next slide. And again, just to highlight this, I think Teon, you've done a very good job really highlighting the problem. And this is just reiterating this. I've screenshotted a few different example guidelines. Like, this is what medical clinical knowledge looks like, especially inside a hospital or at national level guidelines. Extremely rich in information, but extremely dense and extremely hard to navigate to where you need to find that information. Usually locked away in PDFs and Microsoft Word documents that are complex layouts. So here is a very quick video as well of the Eolas platform, and it just really helps solidify the context, and we've given a quick demo of how it's being used. So again, the platform itself is split between external medical knowledge. So in this section, the Knowledge Hub, we index all of the world's medical knowledge. So tens of thousands of pieces of national level guidelines, all the medications that a doctor could potentially ever prescribe is here in one place, as well as lots of other information. The other aspect then is the internal medical knowledge. So this section shows all of the internal referral pathways, clinical guidelines, etc., that a hospital would use. They break it down then by medical specialty, and then within each of those folders, they'll upload their content. And here you can see an example of one of those guidelines. So again, lots of useful information within this as a document, but it's maybe 40 pages long, and there's lots of complex diagrams and difficult layouts to understand. Especially AI systems find it very difficult to understand that. So what we've built then is Ask Eolas. So this is the first use of computer vision to build a RAG search pipeline specifically for healthcare. So we ask a question here, and the users automatically get an extremely high fidelity answer back. So quickly they'll get an answer, but most important, as you said, Teon, there's this aspect of visual grounding. So as soon as they click the reference, it brings them exactly to the point in the diagram of where the answer has come from. And this is really important for a number of different reasons. First of all, as the users are using this, it's much faster to find the answer. And it also then visually grounds it, so they're much more confident. So that's just one aspect. The next aspect downstream is then, how do you integrate all of this knowledge at the point of care? How do you integrate this into electronic health systems? Agentic AI is going to need to access all of this knowledge, and that only works if the knowledge is extracted with high enough fidelity in the first point. So that's why LandingAI has been very helpful for us. We use lots of different platforms, and we found that with using LandingAI, it extracted it with the highest fidelity and the highest accuracy rates as well. So if we just move on to the next slide as well. So what we've been able to prove with the Eolas platform in general is that we've shown a 90% reduction in time spent searching for information, which is really important. So if you remember back to the previous slides of, there's $100 billion spent every single year across health systems in just searching for this information. So with that time spent reduction, more patients are treated and seen. You've got a lower cost of care delivery, and staff are generally happier. They want to use the tools that actually work for them. The other thing that we can do here is everything that's on the platform is fully tracked. So all of the queries, what information that was surfaced, when it was surfaced, who viewed that information. So we can prove then compliance and the utilization of those protocols. So this decreases medical errors, improves patient outcomes, and decreases litigation as well for the health system as a whole. So I think handing it back to yourself then, Teon, for these slides.
Declan, that's fantastic. Thank you for the overview. It really kind of brings to life exactly what the value you got from our products, and also how you're doing things. I'm curious as to, just before I jump into my next slide, where do you see kind of the use of AI going within your business? Because that could be quite interesting to understand.
Yeah, 100%. So really, what we have is a vision that every single time a medical decision is made, that it's informed by the latest medical knowledge. And there's 50 million healthcare professionals making billions of decisions every single day. Every time for each patient, the medical knowledge should be queried in real time for that patient, and then the best decision being made. So what we're now building is an API to the knowledge base. So this can be seamlessly embedded in point of care systems like electronic records, ambient voice technology, etc. So if you imagine the patient note is taken, this is a 65-year-old man, XYZ, That note is then sent to the knowledge base, and that knowledge base is built from all of the medical knowledge internally as well as externally that's been extracted using computer vision. Then in real time, we're able to then give back, hey, for this patient, this is the best thing to do based on all of your internal guidelines, and here are all the references, and here's exactly why we think that's the best thing to do from this guideline. Healthcare doesn't scale. There's never going to be enough doctors, nurses, pharmacists, and we have a critical problem here in healthcare in general because of that very reason. And AI has come at a critical juncture, and it only works if it's done safely and accurately. And that's really why we think computer vision is the way to go here when building out these pipelines.
Very interesting. And you've obviously been through the journey. I mean, you've personally built a fantastic company. It's growing fantastically, and you've got a really interesting niche in the market that you've identified. What kind of advice would you give to companies that are going on this journey of kind of building use cases around kind of visual AI using document extraction? Any ideas as far as kind of where to start, what things to look out for, and what to make, how to get the best out of the investments that you make?
Yeah, no, that's a great question. So I think fundamentally, regardless of what technology you're using, is start with the problem. Using the tech for the tech's sake isn't the right approach, I suppose, in general. Always start with the fundamentally, who is this going to benefit? What problem am I actually solving? And then is this the right technology to solve that problem? And that's kind of the approach that we take. A lot of the time, maybe new technologies comes along and you try things and they're not a fit. So I think defining the problem is the most important thing initially. And then the next most important thing is getting into the hands of those people that have that problem. And does a solution, is it a big enough problem that exists for enough people? And does the solution that you're working on actually solve that problem, and get evidence of that as quickly as possible? Evidence of that idea of product market fit as quickly as possible. So our journey for that was trying lots of different things. And it is a trial and error process, and it does take a while to get to that point. But yeah, that's be problem obsessed, I would say.
Yeah, absolutely. And if we just narrow it down slightly into the kind of the conversation that we're having at the moment with landing and obviously the technology that you're actually using to fix the problem. What else did you look at in the market? Kind of, you don't need to name names, to be honest, but maybe just different approaches that you've seen other providers provide in this area, and maybe just why you decided with LandingAI, because I think it's important just to kind of understand, we are having this conversation and I think you're quite happy with what we do. So it would be great just to get your kind of feeling on that. And I promise everyone on this call, I've not paid him to say good things. But don't say bad, Stefan.
Yeah, of course. Yeah, never would. So no, in all honesty, we tried lots of different platforms. Somewhere between 5 and 10 for the knowledge extraction side of things. And even OpenAI with their Vision API as well. And we found the fidelity and the accuracy of the extraction just wasn't high enough to justify building a full RAG pipeline that's used millions of times per month. And the error rate was much too high. And unfortunately, that then starts to compound through an entire RAG system. So if you have any inaccuracies in the extraction of the data at the very, very start of that and the indexing of that, everything then from your retrieval right down to your generative aspect of giving answers back then is off, and it increases the magnitude of that error then. So we spend a long time trialing lots of different systems, and we found that LandingAI by far had the highest accuracy. It was all of the other features associated with that as well, that you get a significant amount more metadata associated with all of the data that's able to extract just by the nature of the use of computer vision to extract it. So we found that very useful as well in the indexing phase of the pipeline.
Interesting. Okay, great, fantastic. Grace, do you want to, are there any questions specifically from people that they want to go into, or how do you want to play this?
Oh, yeah. No, so there's one question maybe we can cover, Declan. There's a question about curious how team would characterize the development process. How long did it take to build the application from MVP to roll out? And how did you find using LandingAI API? Was it large development effort? So I don't know if you can cover on that.
Yeah, so end to end, it probably took us about 6 months, but that included a few months of evaluating lots of different players at the start of that as well. So really, once we decided on landing AI, it was around 4 months. And the API is very simple, very easy to use. We're able to build it into our pipeline on AWS very simply as well. Team's been great. So at any turn, we've been able to get a lot of support. I think at the early stages, we had a design partnership with the team at LandingAI as well, and we were able to feedback. The other thing that's been really useful is the velocity of the feature set that's been launched from the LandingAI team. We would try things, we would test it, and then we'd come back to the team and say, hey, we love this bit, but this is really limiting us. And we would then get a feedback from the product owners that, yeah, we're working on that and it's going to be launched next week. So that was kind of the consistent message we were getting back. And it just really helped solidify our decision to go with LandingAI as well. So yeah, no, very, very simple, very, very easy to use.
Grab another question, Grace. It'll be great.
Sure. So there is a question about, will it be specific to any modality like brain MRI? Maybe it's a question for Declan.
So it's probably, maybe that's more for yourselves. I know, just talking from our point of view, what we use our knowledge base for is everything that's not patient data. So all of the clinical guidelines, policies, procedures. So we don't actually apply this to any clinical data as such. We don't show it scans or any patient data. We do show it, medical flow charts for decision making, graphs, everything like that, which we found that it's very accurate. So we've never actually tried it on radiology data or anything like that.
We also have a question from an anonymous source, really around the accuracy of the document retrieval, which is obviously, there's a couple of questions that have come through on that subject. It is a fundamental issue, and one of the things that we are making some great strides in that area. So one of the things we've just launched is a confidence score on our extractions, which is something that we found is a very important part of adding that additional layer of confidence in what's being extracted. So the view there is, if you are seeing a number of documents coming at a very low score, there's various approaches you can take to then deal with it. Either work with us very quickly to get adjustments made, or potentially get some human in the loop review done, just to make sure that things are in the right place. So there's various options around that we can do. Couple other questions around speed. I think speed of extraction. I can't give you exact numbers, but I can definitely say it is in the thousands per second. So we have got exceptional bandwidth, which is we're really excited about. We can actually, we're happy to work with, if you want to contact us afterwards, we're happy to give you some more information and some specifics on our extraction performance. But one of the things that we are very focused in is obviously having a very strong benchmark and being the top of the market in this area. One other question that came past, and then Declan, there's one for you. You can see coming through from a hospital actually, which could be one for you. I'll let you jump on that. But there's a couple of asking about deployment options, which is an interesting one as well. So this is an interesting one, and I think it's one of LandingAI's really strengths. So as we've come from a kind of an AI background, we're not a company that started playing with OCR, and then over time we started to add an AI component to what we do. We are fundamentally a unstructured data and visual AI company. So we are built for enterprise. That's really important. So what that means is, as a company, we are very focused at helping whether your company is small, medium, and large, to adopt the technology, and we've got all the processes and actually structure within our company to kind of help you go through that, which is as you can appreciate, security, compliance, as well as all those other aspects. We also have the ability for you to kind of host your data in Europe, which is important for a lot of European companies, so we're happy to do that. As well as we give you various options of really how you can host and access our platform. Our preferred option is always our multi-tenant SaaS cloud, which is our preferred option, but we do provide other ones for companies who have higher data requirements for having it more within their domain. And the good news there is that with the multi-tenant SaaS, we also provide zero data retention, as well as allow you to have the ability to control, all aspects of it, as well as the core thing. And this is one of the key aspects that people really like, is that as we are, and Declan mentioned this a few times, as we are just iterating on new features that are coming out literally on a weekly basis, with accuracy improving and us actually becoming better and better at extraction, we are now able to roll that out to you immediately within the week. So that's really exciting from our side. So just wanted to kind of give you that information. And then the last point I just wanted to make is we've also got a fantastic partnership with Snowflake. So if anybody on the call is a Snowflake customer, our Agentic Document Extraction API and solution is also available within Snowflake as a native application. And that can be actually even purchased through the Snowflake marketplace. So what that means is that you can access us within your Snowflake instance, and that can be a very powerful way of using LandingAI, as well as you can also obviously purchase us and use us external Snowflake. So that's quite exciting as well. Declan, there's this interesting question about a small clinical hospital or clinic. Did you see that one?
Yeah, exactly. Yeah, perfect. Yeah, so it's very, very easy to roll this out. Once we have your content, we just upload it within about 1 or 2 days. The entire content knowledge base is indexed, and then you can just give it access to your users. So there's virtually no lifting from an IT team at all. Just a few sign-offs from a cybersecurity point of view is what hospitals usually do, because it doesn't contain any patient data and it's all policies, procedures. So from a going live point of view, we could probably have content live within the space of a week or two for those hospitals. Just on the other questions as well. So there's a few questions here around, generic or fine tuning client specific models. I'm assuming that's for us, for the Eolas platform itself. So how the platform actually works is it uses RAG-based search. So we actually don't do any fine tuning at all. So a lot of hospitals might have thousands of documents. So that's number one, is too big for a context window if we're going to put everything into the context window. Number two, the documents change very frequently as well. So maybe on a daily basis they might change. So we don't refine tune that. We find the best approach is to do RAG. So we do a RAG pipeline. It then returns usually about the 15 most relevant chunks, and then that is entered into the context window with lots of prompt engineering as well to make sure it's clinically safe. The other thing we do with regards to the prompt side is that it's user specific as well. So all of the users on our platform will have to, enter in their specialty, their seniority, their hospital, etc. So we'd use that as further context, because realistically the answer that, how to treat a heart attack is going to be different. If you're a senior cardiologist, you're going to want much more detail than if you're a junior nurse. So the answer is going to be slightly different, and that's part of the prompt as well. So that's how it works from that point of view. So I think that addresses a few other questions further up as well. Cormac had a question around the RAG based vector queries. And then there was an anonymous question around the accuracy of the retrieval. So I think it's a great question as well. So we use RAGAS, which is a framework to validate the retrieval aspect of the pipeline, as well as then the faithfulness, hallucination rate, and the accuracy, the groundedness, etc. As well. So that's how we measure that. We actually map the RAGAS score to a senior physician, a senior clinician. So we have a human in the loop that allows us to then scale that score to millions of questions. So yeah, that's a very, very quick answer for those questions as well.
There was one question around your tech stack, Declan. You've already mentioned something there. I don't know if there's anything more you want to elaborate on.
No, I think I give a decent overview of the tech stack on that side. Yeah.
Okay, perfect. That's great. And I think just on the tech stack and building it out, I think one thing that we also pride ourselves as a company, and this comes back to our kind of pedigree in working with companies and enterprise companies as well, is we view our engagements, as we do with Declan, as kind of partnerships. So often we get involved in actually advising and providing kind of input on best approaches and what you should be doing and how you can kind of leverage aspects of AI in the best possible way. That's kind of a value add you always get from working with LandingAI. Okay, I think that's great. There was one question around EU. We do comply with all EU laws, absolutely, and also as far as kind of data leaving the EU, if you do want your data in the EU, we can provide that. So from that perspective, there will be the option if you want to keep your data in the EU. Just I think it was one of the questions that we had. So please be in touch with us. We're happy to give you all the information you need on our data in the EU compliance part. I think that's it. Any other questions, Grace, from your side that you think we need to jump on? I'm just keen to get as many as possible, but at the same time, I don't know how much time we have.
Yeah, so I think there was some question how to access. So I just in the chat, I shared the our platform playground where people can actually upload the documents and test out, as well as documentation for more detail and quick start guide. And if you have any additional question, feel free to reach out to us, sales@landing.ai. Yeah, I think that's
I think it's a really good point. Just to add to what you were saying there, Grace, we are very keen for you to experiment and play with our technology, which is great. So please feel free to go online and have a play around. If there's anything you don't like or see or does not working in any way, please get back to us. So we're always iterating and learning, but you'll see there's some fantastic results. We've actually been inundated since we launched the product about 4 months ago with demand. So we pretty tight on resources at the moment. But what is quite interesting, if anybody on the session today would like to really take the next step, we're more than happy to work with you in various contexts. First, you can obviously have a look at the product online, like Grace said, in our playground, see how the product's working. Obviously, that's an open environment, so please don't extract any confidential information. If you want to run a POC or a pilot, we also have options around that, which can be very effective. And we have some of our big customers running, pilots where they're developing use cases, and we're working with them on that. So that's an option as well. So we're more than happy to engage with you with various different ways, which can be quite effective. So just to let you know from that side. I think that's it from my side. I think just generally speaking, I think just to sum up, on the final slide, I think, we spoke today around kind of LandingAI's approach to this very interesting part of the market around AI, and how we have built a really interesting piece of technology which can really help companies extract data in a very accurate way. I think we are doing things that we're kind of pioneering the market. And I think because of the way that we're doing it, which is different from what a lot of other companies are doing, we're starting to see results that are just kind of putting us in a different place, which is really exciting for us. So I think this is now opening up huge opportunities for companies to start looking at use cases that they didn't even think could be done. That was one point that I had from one of our very large life sciences companies. I actually asked a question, which was, what value do you see coming from this use case? And they came back saying, to be honest, we didn't even think this was possible. So, you're taking us in a place where we are extracting value, which wasn't even known it could be done, which is really exciting. So this is kind of the power of AI, and then we're all seeing this in the work we're doing on a day-to-day basis. So from our perspective, I think, these are new opportunities that exist. We've got fantastic we've got fantastic use cases that we can also share with you. So if there's an opportunity for us to engage, that'll be great. And obviously, Declan, from your side, if there's anybody interested in Declan's fantastic company and all the services he provides, please be in touch with him, because he's got some great things to share on his side as well. Declan, any final words from your side before I think we wrap?
No, thanks very much for listening, everybody. It's great to jump on and chat about what we're building. Yeah, as Teon said as well, feel free to reach out to me at any time as well. So LinkedIn is pretty good for me, or even just directly via my email. So Declan@eolasmedical.com. So EOLAS medical.com. So feel free to reach out as well. More than happy to chat to anybody interested in using the solution, or even just anyone building in the space that wants to chat as well.
Fantastic.
Awesome.
Great. All right. Grace, over to you.
Yeah, thank you. Yeah, thank you to everyone joining to this webinar, and special thanks to our speaker, special guest speaker, Declan and Taeyan. And please follow us on our social stay tuned for our upcoming webinars and events. And with that, we can wrap up the webinar today. Thank you, everyone.